My name's Suzanne Turner. I'm a relatively new in post as a regional nurse advisor working for Defence Primary Healthcare. And my role involves working at a strategic level and I look after the nurses across Scotland and Northern Ireland in the defence facilities. You might be wondering why I'm doing this presentation. So I just wanted to share with you a little bit. There's a lot of change going on within defence, and I'm sure that those who work within NHS and other organisations acknowledge that this change is quite disruptive. And last year there was a period of change going on within our workplace, and staff was not aware whether they were going to have a job at the end of it, whether we were merging with another facility, and it was a very unsettled period. And over that period of time, what I did notice is that people's behaviour, the way that they spoke to each other really deteriorated. We worked with military medics and had a civilian doctor, and the way that they spoke to each other was really quite unnerving. And people would have arguments in front of patients. And obviously this wasn't an intentional thing. It was just, unfortunately, people were feeling stressed, they were busy, lots going on. It was a very difficult period for everybody, and stress does take its toll, as we know. So what I decided to do was consider what are the effects of incivility in the workplace, and what did that mean for our patients, but also for the staff working there. So I did a bit of reading and realised that actually there's quite a lot of literature out there that looks at incivility in the workplace and the impact on both patients in terms of patient safety, and also the impact on staff, where the incivility is directed towards, but also for those people who are on the peripheries who maybe observe this. So yeah, lots of research out there for sure. And what it does state is that there's actually a quantifiable and a significant impact on our ability to perform if we are on the receiving end of incivility or indeed witness it. So what I discovered is that whilst I was doing my research, I actually came upon this fabulous website called Civility Saves Lives. And it was actually put together by Dr. Chris Turner, who is a consultant from Scotland, now working in England. And I discovered there was a whole movement going on. There was lots of information available on there for people to access. And it's about health boards being able to tap into this information and understand the impacts that incivility in the workplace actually has on their staff and on their teams. Because ultimately, when we're all working, we might be working in an independent singleton post, but ultimately we will have connections within the bigger team for sure. And I was concerned from my own personal perspective, what were the implications on the team that I was working in? And I could see, as I'd mentioned before, the changes within the team dynamics. What is clear when we do work within a team is that when we are valued and respected amongst us, the benefits actually impact not only us but also our patients. So everything that we do, as we all know, is for our patients' benefit. That's why we're in healthcare. And it doesn't matter, how the team dynamics work and the dysfunctions within team dynamics or really good teams. Ultimately, we are there for the patients. And all the evidence shows that really good cohesive teams actually perform much better, and it leads to better outcome. And all the evidence actually indicates that there are obviously advantages to having good cohesive teams. And good cohesive teams involves relationships with people and behaviours. It's about having good communication. So what I did discover was that the King's Fund had actually undertaken some work, and as you can see on the slide, what they found when they looked at incivility in the workplace was it actually reduces, it increases staff satisfaction for sure, and it increases staff performance. And they also found that staff are more likely not to go off sick. There's better outcomes for patients. And this was all founded and published within this King's Fund survey. So that's really why teams matter, because there is a definitive patient safety implication. So what does incivility actually look like? And we've probably all witnessed this to some extent. And it might be colleagues shouting at each other. There might be, talking, eye rolling, there might be tutting, there might be a bit of aggression. And when I reflect on my own behaviours, if I'm being perfectly honest, I've actually taken part in some of these behaviours myself. I've tutted during meetings, I've rolled my eyes, and that all leads to incivility and a breakdown within the teams. So when we think about what causes incivility, ultimately it's about a lack of self-awareness, a lack of insight. But it's also acknowledging that we all have busy workloads and stressful lives, and that can impact on how we behave in our workplace. We know we have staff shortages across NHS, in the third sector, and also in defence. We're experiencing a crisis within our clinical staffing, that's for sure, and also poor leadership, and that's just to name but a few. So I just want to go back because I've skipped. I should have played you a video there, so bear with me. I'm just going to share another screen. Sorry, I can't get out of my system now. Bear with. Sorry, I'm going to have to go to the end just to play this. Bear with me. We had it all set up previously, and for whatever reason, it's disappeared. So there we go. Can you see the screen? With the YouTube video, brilliant. Okay, yeah. I am just going to play.
In the emergency department at the same time as an acutely short of breath 4-year-old girl. The nurses put on the monitoring, the doctors examined the child and spoke with the mother. And after a few moments, they met at the bottom of the bed. They had a discussion about what they thought should happen next. It was passionate, it became heated, voices were raised. And eventually they decided to go with maximum drug therapy and that they wouldn't do her breathing for her at this moment in time. The intensive care doctor left. He went back to his department and the paediatric doctor started trying to get intravenous access in the little girl's arm. The nurses asked, "What do you want us to give next?" And he replied, "Aminophylline." They spoke for a moment or two and then they leaned forward and said, "How do you make it up?" Because they were adult nurses and there were no paediatric nurses in this department overnight, and you make it up differently for children and adults. He said, "Look, just go and look it up, will you? I'm busy." So they did. They went away, they looked it up, and then they came back maybe 10 minutes later. When they got back, he was still struggling to get this intravenous line in.
I think it's a great idea. House sitters get somewhere to stay and we the house.
Sorry,
owners get someone that. To.
They said to him, "What rate do you want this to go at?" And he looked up and said, "For God's sake, leave me alone. Can't you see I'm busy?" And they did what we would all do. They took a step back. They took a step back and they waited. And they got the line in, they wrote the script, and then connected the drug through the pump, through the tubing, and into her arm. And over the next half hour, she received 15 to 20 hours worth of aminophylline, a very toxic drug. So what happened next? Well, after a rocky few hours, she did just fine. But there was, of course, an incident form. There was, of course, an investigation. What did that find? It found that the nurses hadn't been competent. It found that the nurses needed retraining. In fact, the nurses shouldn't be allowed to give any drugs till they'd had retraining, and there might have been some communication issues. And I think we missed the point, and I think we missed the chance to be better. Many of us work in teams. Healthcare is no different. We deliver it in complicated, sometimes complex environments with varying outcomes. And for the last 10 years, as well as being an emergency medicine consultant, I've been a safety lead, investigating and trying to understand situations just like this one. And if 10 years ago you had come and asked me, said, Chris, what do you think the answer is? I'd have been totally clear with you. I'd have said it's process. If only everybody did what they're meant to do. But there's a problem with that. You can only investigate so many of these when you know that the people involved are knowledgeable, good, diligent professionals before you realize that you must be missing something. And I was missing this. Process is written on paper. But practice happens between individuals and in environments. And I simply wasn't respecting the complexity of the situation. So now, if people come and ask me, what do you think the answer is? I still think process has its place, but something else is more important, and that's people. And I think the evidence bears me out on this. So if we work in teams, what makes teams perform better? Well, in 2015, Riskin and Erez published the first of their landmark papers. In it, what they did was something that hadn't been done before. They took teams who were matched for expertise, and they put them into a patient simulator, and they measured the outcomes. Half of those teams were exposed to mild rudeness. And what did they find? They found, unsurprisingly, that we grade on a curve. We grade from the truly fantastic care that we all want for ourselves and for our loved ones, all the way around to the catastrophic care where patients die unnecessarily. And they found that one factor was responsible for 40 to 60% of that variance, and that's incivility or rudeness. In fact, it looks like for competent teams, the single most important factor determining the outcome of that team is how we treat each other. So incivility. If it's such a big deal, how come we don't know about it? I never got taught about it in medical school, in my membership exams, or my fellowship exams. It's because this is new science. Between 1996 and 2000, on all of the academic papers, there were only 23 about incivility, rudeness. Between 2011 and 2015, there were 1,700. And they pretty much all say the same thing, that this stuff counts. So I should ask, has anybody here seen rudeness at work? Maybe to you, maybe to somebody near you, or maybe it's been by you, and it's certainly been by me. How did it feel? Now, my guess is there's a bunch of people, when they're thinking about it, feel angry. But that's not where we start off. In the moment when it happens to us, we feel belittled, ashamed, humiliated. We feel powerless, like children. And then slowly, over minutes, sometimes hours, sometimes days, we start to make sense of it. And then we find ourselves saying, how dare you? How dare you treat me like that? And that's when we find the anger. So today, I'd like to talk about two of the groups that are affected by incivility. Because now, thanks to the wonderful work of people like Christine Porath, we're able to put some numbers onto this. And to do it, I'd like to talk about bandwidth. Because on a good day with a following wind, we're pretty smart people and we can deal with 5 to 7 things. But we have lives, we have cars, bills, houses, family, and it takes up space. So by the time we get to work, we're maybe dealing with 3 or 4 things. What happens when somebody is rude to another person? What happens to the recipient? And I'm talking here about mild to moderate rudeness. I'm not talking about screaming and shouting in your face. That's completely different. On average, when somebody is rude to us in a mild to moderate way, our bandwidth reduces by 61%. And then we cart it with us through the day. We cart this thought of what on earth happened. And then at the end of the day, we get in the car or on the bus and we're sitting there and we feel a wee bit safe and our bandwidth starts to open out again. And then we have that moment where we go, boom, that's what I should have said. That's what I would have said to him. And that's because in that moment, you're back. You're back to being the wonderful, smart, witty self that you are. And in the moment, you weren't. In the moment when it happened, we are quite literally less. When we do it to somebody else, we make them quite literally less. What about staff onlookers? Well, I'm reminded of an episode in the emergency department. My colleague had tried to refer a patient onto the neurosurgical team. The neurosurgical registrar had said, no. And I know him, and he's a good guy. I didn't know that he was a good guy having a bad day. I said, let me go and chat to him. I'm the big man, eh? So I went along, and I said, got this patient, really like you to see her, neurosurgical problem. He said no. Second tactic. Listen, you know that patient? I'm pretty sure it's a neurosurgical problem. If I'd been smart enough at medical school, I'd have really liked to be a neurosurgeon. And you're here, and you think I'm joking, that really works. And you're here, and he said no. And I'm maybe beginning to get a wee bit angry. So I decided to drop the C-bomb, because that's the way I roll. And I said to him, I need you to see this patient. I am telling you to see this patient because I am the consultant. And he looked at me. There's quite a lot of eye looking going on at this point. And he looked at me and he said, did this. What do I care? I'm going to be a consultant someday myself. And I had nothing except this. I can tell you in here today that the red mist can descend from the Pentland Hills, just outside Edinburgh, all the way into an emergency department in Midlands in under about half a second. And as I stood there, and my voice got louder, deeper, and more Scottish, and I drew myself up to a full 5'7.5". I saw 2 things happening. The first was that my wonderful, fantastic, amazing colleague, the nurse in charge, did precisely what her title says. And she belted round her desk and she charged across to us because whatever this crap was, she wasn't going to let it happen in her department. And the second thing was this. I saw the heads starting to go down. First one, pop. Then another, pop, then pop, 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 pop. All these heads going down all around, all apart from one guy. It's about 3.5 meters in that direction. And he's leaning against the desk and he's watching. And in my corrupted memory, he's opening a packet of crisps and getting a can of Coke out, because this is the most fun he's going to have all day. And I thought those guys were just going back to work, but they're not. The first thing they're doing is avoiding the eye of Sauron, because we know that the way that somebody has just treated the last person is likely to be the way that they treat the next person. And something else is happening as well, because they actually have their bandwidth impacted too. And on average, they are 20% reduced in their performance.
Is there a way to regain control?
Thanks, folks. I think I'm going to pause that video there because I think we kind of get the gist of it. I'm just going to stop sharing a moment and then bring the presentation back. So hopefully you should all be able to see the screen again. Could somebody just, because I can't see people on the screen at the moment, if people could just give me a shout yes.
Yes.
Yeah.
Perfect.
Yeah.
Thank you. So I think for me, you get the gist of the TEDx talk that Dr. Chris Turner did, and I found it very powerful. And I think on reflection, what shocked me, and I'm sure, you know, if you think about it yourself, the bandwidth of the person who is affected by 60, or it's reduced by 61%. Those who observe incivility and rudeness to their colleagues, etc., they are affected by 20%. It's quite shocking statistics. What we also know is that our cognitive ability, if we experience or hear incivility, our cognitive ability is actually reduced to 60%. And up to about 80% of people actually spend time worrying about what has taken place. They ruminate, they carry that burden with them. We know that there's a reduction in the quality of work. We know, because the evidence tells us, that errors are made, clinical judgments are affected. And ultimately, it's a negative workplace culture, which is one of the most common reasons why staff actually leave the profession, which is really quite sad. Sorry, I'm trying to get this to play. I do apologise for these technical issues. So obviously I'm talking as a nurse, but we know there's lots of professional codes of conduct out there. And from a nurse perspective, the NMC is really very clear. And in the code of conduct, it actually tells us about treating people with kindness and compassion. It tells us to act with honesty, integrity at all times, and to treat people fairly without any discrimination, bullying or harassment. It also is very clear about being aware how our own behaviour can actually influence and affect the behaviour of others. And it tells us to work in partnership with people to make sure that we deliver safe and efficient care. And finally, it tells us to deal with differences or professional opinions with colleagues, you know, through discussion or debate, etc. And that we should be respecting that and accepting that we all are individuals and we all may have differences of opinion, but we need to actually behave in a professional manner. I did take a bit of time and looked at the GMC Code of Conduct, and I know there's the HCPC Code of Conduct, and I've put links at the end. And what I would suggest is if you all go back to your own workplaces and at some point just have a little look and see what your own professional code of conduct tells you with regards to behaviours in terms of how we treat people. So how do we tackle incivility? And there's a couple of indications on the slides, but we need to actually, you know, listen and notice what's said. We need to have courage to intervene and call it out, but also call it out in an appropriate manner. Key thing is not to respond in the same tone. And I know myself, I've been guilty of that. You know, when somebody speaks to you in an incivil manner, there's sometimes that, you know, as humans, we respond in the same tone. And if you're in any doubt, or if you don't have the courage to actually call it out, actually speak to a peer or a manager who can speak to we use the word offender, but to speak to the individual on the receiver's behalf. And it's really essential that we build trust in the team and that these team dynamics are cohesive and safe. But I think importantly, it's about role modelling behaviour. How can we move from rudeness to civility in the workplace? How can we promote on a, you know, in everyday culture, compassion and kindness? We're all maxed, we're all really busy people. We all bring all these additional, you know, home and domestic situations into our daily work. We need to ensure that bullying and incivility is not an everyday event. We need to ensure that we're not just bystanders.
It's a webinar over fairness in the workplace and how you speak to people.
Sorry, can I just ask you to turn
Hi.
your mics off, please? Um, so we need to ensure that bullying and incivility is not an everyday event. And we need to make sure that, as you know, we are not just bystanders, but we're actually able to challenge without detriment to ourselves. And it's about changing culture. And we need to start with ourselves. That's our first place. We actually need to hold a mirror up to ourselves and think, how can we do better? Consider how our incivility actually affects others. We need to role model behaviours, and it's a good place to start and to start nudging other people within our circle of influence. So a thank you, an act of kindness, gesture of support, and even asking, how are you, makes a difference to that individual. We need to challenge poor behaviour, as I indicated before, and things like rudeness, etc. And it can actually help to strengthen your courage to take those daunting steps and actually speak up on behalf of other people. We need to become more active and not take the passive choice and do nothing. We need to become understanders and recognise that as a choice, as we observe incivility in the workplace, we have a choice whether we can actually make that difference. So on the screen, you can see there, the standard that we walk past is a standard that you accept. And interestingly, I work as a civilian with the military. It's actually from the Chief of the Army Lieutenant General, David Morrison, who this was his one of his sayings. And it's something that I really believe in. So I'm just going to leave that on the slide. And I just want to share with you a little personal story. And when I did the presentation within Defence to the nurses, we had a nurse outside of our region who actually offered up her story. So what I'm going to do, I'm not going to use her story today. I'm just going to use my story as I have been on the receiving end on incivility. So again, I'd just like to share with you that we know within NHS, approximately 85% of nurses have been subjected to incivility in the workplace, which is quite shocking. We've all worked with people who've used condescending tones, unprofessional language. We've been rude to patients. We've witnessed outbursts of temper, anger, unnecessary raising of voices, and the list goes on. But it's a little concerning, and certainly within a military context, we all undertake mandatory training, and one particularly within the MOD we take is active bystander, and it's all about respecting the workplace and conflict resolution. But actually, organisationally and as individuals, do we really take heed of that? So if any of you actually heard or witnessed a team member being berated or being aggressive within the workplace, how many of you would feel strong enough to challenge it and intervene? How many of you would feel strong enough to intervene, challenge and support that colleague? And it is incredibly difficult, and even more so when you've been on the receiving end. So in terms of my story, it was probably about 2 years ago, and it was at a time when meetings were all taking place online. And I was involved in a meeting. There was probably about 30 people on that meeting. During my element of the meeting, I was asked to present some figures, etc. The head of the establishment, in effect, called me. He said I was crap. I was ineffective. I was really taken aback. I paused. I didn't know what to do, and I could feel myself. He was quite angry, and I could feel myself getting quite emotional when I was trying to present these figures. And his tirade of abuse continued. He was using derogatory terms, etc. So I terminated the call, and for the first time in my entire working life, I actually turned my computer off and I walked out of the building. I got in the car and I sat and cried. I had never ever experienced anything quite like it. I'd experienced mild incivility, but nothing in a public forum like this. I did ring my area manager to explain what had happened, and I did go back into work the following day, but my whole demeanour, etc., had changed. But what was interesting, there was military personnel on that call who was coming into the med facility, because at the time I was working as a practice nurse. They came into the facility, and a number of them independently said, I'm really sorry that you experienced that on the call yesterday, but I wanted to say something, but I couldn't. It was really a very difficult situation. I found that my integrity was questioned, but nobody had had the courage to stand up and actually intervene or challenge that behaviour. So I'd just like you to really reflect within your own working situations. When have you been on the receiving end of incivility and you've not been able to challenge it? When have you witnessed it and not been able to challenge it? So I challenge you now all to challenge incivility. I challenge you all to make the workplace better, not only for ourselves, but importantly for our patients. And thank you very much for listening. I've got my contact details on the slide here. I've put links into a couple of websites that you might find useful. And I would say if you are experiencing any issues with incivility in the workplace, please seek some support from either a friend, a colleague, or your line manager, and let's stop incivility in the workplace. Thank you.